Hello, all. My topic for semester project is medical application of nuclear physics. My personal goal is to get into the med school by 2023. And so I wanted to choose the topic that is some or the other way related to medical stuff. So I went for medical application of nuclear physics. So the medical application of nuclear physics starts with the nuclear medicine. So nuclear medicine is the medical specialty where diseases are diagnosed and treated with the nuclear radiation. And our entire body function can also be assessed with the nuclear radiations. So the nuclear medicines is further divided into three categories, which is imaging, non-imaging, and therapy. Imaging. In imaging, the imaging includes the machine that works by the gamma rays, such as X-ray, CT scan, bone imaging, like full body imaging. And it is the very first aspect in which the disease can be diagnosed, or we can know that where exactly the problem is, or the breaking of the bone can be known, or we can, like, if it's the chest x-ray, then we can find exactly where the cough is, or if we are having pneumonia, bronchitis, any heart or pulmonary disease also can be identified through imaging. Next is non-imaging. So non-imaging includes the radio labeled blood. So like it is the middle stage, and like the specific target is found where exactly the treatment is needed. Like it is the second stage, and exactly like if we are having cancer, if it's thyroid or endocrine cancer, let's say it's endocrine cancer, where is exactly the targeted cell can be found in this non-imaging stage. So like the blood is like radio labeled with the isotope, and then find, like we can exactly find where exactly the problem is in our body. Next comes the therapy. So therapy is the last and the final step in which the treatment plan is executed. So therapy involves like highly radioactive radiopharmaceuticals, and it can treat the conditions like thyroid cancers, neuroendocrine malignancy, and uh, with with the isotopes like iodine 131. So for it, the therapy can also be used to treat the conditions like thyrotoxicosis. So how exactly does the gamma camera machines or radioactive machines does work? So what the making of the nuclear medicine first takes place in the pharmaceuticals in the radio pharmacy. Now the isotope like technetium-99m is then injected in the person's body, and then the gamma rays are passed through the person's body, and then finally we get the image about, like we get the image where exactly the problem is in our body, like fully scanned image we get it. This is the image, like where you can see, like this is the gamma camera in from which the gamma rays is like emitted. Then the gamma camera goes to the targeted cell for the treatment, and then finally the patient is treated with the radioactivity. Now, how are like modern days isotopes used to cure the cancers? Like, so there are some isotopes like iodine 123, which are very low gamma emitters. So they are used to diagnose thyroid cancers. But there is also iodine 131, which like radiates more, like which penetrates more beta rays. They are beta rays emitter. So they are used for the treatment of meningitis and thyroid cancer. There is also gallium 67, which is very old tracer, and it is used to identify the infection in middle ear. And gallium-68 is modern tracer from which the neuroendocrine cancer can, or the prostate cancer can be diagnosed. So here is the image of gallium-68 tracer image, like the image taken by gallium-68 isotope, by using gallium-68 isotope under a gamma rays. So here exactly it shows that the white part right here it exactly shows where the cancer is. So like you just don't have the brief that it's a neuroendocrine cancer. You exactly know where the targeted, like where exactly the cancer is, and then you can also treat it by radiopharmaceuticals. The main and foremost thing is like removal of radioactivity. So once if the radioactive like isotopes are inserted in your body, like technetium 99M or gallium-68 is inserted in your body for diagnosis or treatment. Now there should be a way, because you cannot stay radioactive forever. Human cannot stay radioactive forever. So there should be some ways to remove that radioactivity from your body after you are done with the diagnosis or the treatment. So the researchers, the person who, like the people who were using this rate for isotopes for diagnosis or treatments, they came up with a fantastic idea of like hot toilets. So like they can urinate. So when when the person who was treated or diagnosed through radioactivity, so their urine is still going to be radioactive. So you cannot allow the person to like just go to the normal toilet and urinate, because it's going to then contaminate everybody else who is going to use the toilet afterwards, the after that particular person. So they have like come up with the hot toilets. So it is like a biohazard toilet. Like it is only for the people who have underwent the radioactivity, a radioactive treatment. Then as the time passes, the radioactivity of the isotopes also decreases. So the people like who went under these uh, who went under the radioactive treatment or diagnosis should not like go into the public areas and start meeting the people immediately after having the treatment and diagnosis. Give them some like day or two before going to the public places and meeting someone. And once the patient is like diagnosed with something with using radioactive elements, then you can just not cut open and start the surgery for the patient. You need to wait like a day or like at least half life, at least like half time, like half a time. Like if the patient was given isotope by like 9 a.m., then we should wait, like the surgeon should wait like for around 3 to 4 hours for the radioactivity of the isotope to go down, and so that the patient cannot go to the surgery right after having the diagnosis with the radioactivity. And that's all for me. So this is the work cited, and these are the 2 pages that are used to get all the information, and these are the links that I used to get the pictures from. And that's it. Thank you, everyone.